How does PTSD happen? As a trauma therapist, let me explain. We talk about PTSD as a disorder of non-recovery. So that means that most people who experience a trauma will have symptoms that look like PTSD immediately following, but over time, they'll start to get better. We think of this as a natural recovery process. For those who end up with PTSD, something gets in the way of that recovery process. I like to draw it out in a little curve and show that over time, after a trauma, we kind of process, think, and feel, work through, and move forward so that the symptoms are gone. With PTSD, there's something that gets in the way of that. If we think about our combat veterans, if they're in a combat situation, they're not focused on that recovery process. They need to keep themselves safe and alive. We can think about that in other instances of ongoing trauma or instances of unsafety. Or we can think about other things that are barriers to recovery, like a lack of support. They don't have people around them to help them through this process. We can think about alcohol use as something that could maybe get in the way. So there's a number of reasons that can impede recovery. It's not the person with PTSD's fault. It's something that happens. And the work in therapy is to work through the things that are keeping that person stuck and engage in evidence-based treatment to help them to feel better.